Hi, I'm Emily De Silva, and this is my nursing philosophy project. Just to get started, you're probably wondering who is in the pictures on this first slide. Obviously, the center one is Florence Nightingale. The one on your right is my grandmother, Florence De Silva. She was also a nurse. And the one on the left is the group shot of my graduating class for nursing school. The purpose of this project is that we had to develop a nursing philosophy based on what we've learned so far in the class. My nursing philosophy, in its essence, is that the role of the nurse is to put the patient in the best possible position to heal naturally with as little interference as possible. This is accomplished through manipulation of the patient's environment, which is typically why a nursing intervention is something that isn't going to require a doctor's order. Something that requires a doctor's order is usually a medical intervention. So a nursing intervention is bringing the patient a blanket, getting a pillow, changing the position of the bed, adjusting the patient's physical position in the bed, withholding a medication for one reason or another is a nursing intervention, but the order to actually give the medication would be a medical intervention. My nursing philosophy has a lot of influences from I've lost count of number of theorists that we've learned about throughout the semester. Most importantly is Florence Nightingale, which I believe everyone is inspired by Florence Nightingale. It all started with her. Um, and page 132 in our theory textbook for Nurse 314 has a summary of her theory, which was that nurses influence health through management of the environment. And then next is Betty Newman. Her theory was that nurses interact with individuals, families, and communities in interrelated and a goal-directed manner. And that's page 165 in the theory book from our class. Evelyn Adam, nursing facilitates the patient's independence in meeting basic health needs, which is page 169 in the theory book. And Dorothy Johnson, which the nurse helps foster behavioral patterns in patients to achieve homeostasis after a healthy vent produces disequilibrium, which is page 148, and it's kind of a mouthful, but basically it means that the patient's health is not where it should be, and all of these theorists basically are saying you're putting the patient in the position to heal on their own with as little interference as possible. At least that's how I interpret it. And the full reference is on my reference slide at the end of the presentation. To expand on my theory a little bit, nurses rely on a variety of techniques and skills to care for patients in order to provide little interference. Changing positions, as I said, changing the bed position. Florence Nightingale was a big proponent of opening the curtains, opening the window to let fresh air in, a lot of environmental manipulations. Well, she called it managing the environment. Nurses have to be adaptable. What works for one patient isn't necessarily going to work for every patient. So you have to be willing to use your skills in new ways that they may not have originally been intended for, but they could work nonetheless. A good example of this kind of adaptability is an article that I found that you can find on my reference slide that talked about how engaging in play was very helpful for pediatric patients in the hospital. And they tried it with adult patients too, which isn't normally how you would think of play being used. And it was helpful for these patients, these adult patients. So if you want to check that article out, I very much encourage you to. The purpose of the art project, which I in the end found helpful, was to create a visual representation of our personal nursing theories. And in addition to my theory, I have incorporated other aspects of my nursing education so far. I chose to do my art project with crochet, which is where you use hooks like this one to pull loops of yarn through each other. My dad always calls it making knots. It's a very versatile medium. It's portable. You can easily stick it in your bag. There are a lot of techniques, and I've been doing it for a very long time. My project is what's called an afghan, which is where you make several squares out of crochet and join them together. The color is symbolic of the female-dominated profession. There are a lot of things that are symbolic of nursing. There's hearts are a big nursing symbol. I made a little stethoscope, and of course the big RN in the middle. Um, Joining the squares is symbolic of the patient's whole being more than just the sum of its parts. One square is useless on its own, but together it is something important. The cyclical nature of how you put these squares together, because you go in rounds, is very reminiscent of the mandalas that we learned about in class. Each square is a unique design. I don't repeat any of them because each patient is unique. And the project itself is symbolic of my theory because the most basic of nursing interventions is to give the patient a blanket. You are manipulating the patient's environment by giving them a blanket. I used a lot of new techniques for me. I wanted to include that because nurses learn a lot of skills during their education. And this is just a larger picture of the one from the previous slide. The article I found was from the Clinical Journal of Oncology Nursing.